Hello, my name is Luciano Costa. I'm a myeloma physician at University of Alabama at Birmingham. Glad to be here at ASH 2025 and be able to address my friends at HealthTree. At this meeting, I had a chance to present long-term follow-up of cilta-cel on CARTITUDE-4 trial for patients with standard risk multiple myeloma. As some of you might recall, CARTITUDE trial was a trial that brought cilta-cel, a BCMA-directed autologous CAR T-cell, for patients with 1 to 3 prior lines of therapy that was lenalidomide-refractory and PI exposed. And this trial was a very positive trial with improvement in progression-free survival and overall survival. Because this therapy has unique toxicities and has some complexity on delivery because of the need for cellular therapy center, apheresis, and so forth, I think many of us have been prioritized the high-risk patients for that therapy. And so it's important to analyze, to examine the outcomes of patients who have standard cytogenetic risk who go on this therapy. So on this trial, there was close to 60 patients who had standard cytogenetic risk, yet fit eligibility for CARTITUDE-4. And we actually, that definition was patients without 1q gain on amplification, 414, 1416, or deletion of 17p. So we look at that patient population, but also look at a patient population that included the 1q, and that is in order to make a parallel with CARTITUDE-1 trial, which is a trial for much later, much more refractory disease, also treated with cilta-cel. And what we saw is that for standard risk patients treated with this therapy, the progression-free survival at 30 months is over 80%. It's still very high at 73% for patients with standard risk, including the 1q gain. And if you compare this with a population with CARTITUDE-1, more refractory disease, the PFS was about 60%. So clearly the use of this therapy early on gives, not surprisingly, far better results. The other part that I think is very important is if you look at patients who made to the end of the first year, which is the majority of them, more than 80%, and 93% of them are progression-free at a year and a half later, so 2.5 years from treatment. And that is quite remarkable, speaking of the sustainability of these responses. And if you look at the patients who are MRD negative at 1 year, which are 86% of those patients, not a single one had had a progression for the duration of follow-up of this study. Of course, we love to see the longer-term data, the 5 years, so we could have a parallel with CARTITUDE-1. In CARTITUDE-1, we saw that 1 in every 3 patients are alive, disease-free, and disease undetectable at 5 years. And this data give us the expectation that that proportion is going to be much higher in patients with a standard risk who receive this very effective therapy early on.